And welcome back, everyone. We're now joined by Shelly Gearing. She is from the Allen County Health Department. And September is a big month for you guys as you start to get yourselves prepared for National Preparedness Month. So what does that mean exactly?
Well, National Preparedness Month is an annual observance, and it's basically to help people get awareness as to why it's important to plan for any kind of emergency or disaster that could affect you or your area, so that you're prepared enough to know what to do, where to go, how to manage, if such a thing were to happen in your location.
All right, we're going to be talking about a lot of different subjects here today, and they really do fit for everybody, but we kind of want to put a special emphasis on the older viewers out there, because sometimes they're stuck at home alone. Maybe they have some health problems that keep them from moving as quickly and as fast as others might. So we just want them to know that we're emphasizing some special things for them as well. But first of all, we're going to start with some things to consider should a national disaster or something be coming our way.
Yeah, the first thing you want to know is what kind of disasters could affect your area, and plan on what you want to do to handle that. Some may call for an evacuation, which is where you have to leave your place where you live. Some may call for a shelter in place, which is when you stay where you're at, or you find a safe location that you stay at until you're given the all clear that you may leave that area. You want to stay informed. Get a weather radio. Weather is one of the biggest things that causes an emergency here in our area. So get a weather radio so that you know when there's severe weather approaching. You want to monitor your TV and radio stations. And some cell phones have apps that you can download. Some of the older population aren't real savvy with their technology, but there are those apps that maybe a grandchild or a son, daughter could help download to have access to those notifications and alerts for weather and other emergencies. And then as older adults, consider that you might have specific needs after a disaster. You may want to create a support network of family and friends that can help you out if there were a disaster. Make sure at least someone has a key to your home, so that if there is a disaster, they can come in and help you or get things that you might need from your home. And then if you undergo regular medical treatments with a clinic or a hospital, just make sure you know where the backup providers are for those services, should they be limited or not available because of a disaster.
And whether it's a flood, a fire, a tornado, whatever this might be, it's always good to make sure that you plan ahead. And we've got some things for folks to keep in mind when that time is beforehand, when you can actually think ahead of time. Yeah,
it's very important to do those plans ahead of time, because you're not in the middle of it. You can think about what you might need to do, practice that plan that you put together. Put together an emergency kit that would have everything you would need if you are stuck in your home for a few days, or if you need to relocate, you can just grab this kit. It has your medicines, medical supplies, batteries, chargers, anything you might need for any equipment that you need to take with you. Plan for food, water, and essentials for you and your pets or service animals. You want to make copies of your Medicaid and Medicare and other insurance cards. Just throw those in the kit so you have those available. And plan for your transportation if you have needs you can't get out yourself, if you have special needs that you need special transportation services. And then plan how you're going to take any assistive devices with you that you might need, like your walker or a scooter or a motorized wheelchair or something. And then plan how you're going to communicate if you have those communications needs. Like if you're limited vision or hearing or sight, how you're going to access those methods and services to communicate to those that you need to communicate your needs to.
All right, Shelly Gearing, thank you so much from Allen County Health Department, and we are back with more right after this.